Hey everyone, welcome. I'm Dr. David. We are live here. We're going to be talking about 10 things I learned from helping 2,164 people with hip arthritis. And the way that I got this number, by the way, is these are people who have actually gone through our hip arthritis recovery program. So we just went into our database and saw that that's where we're at today. Today, it's the end of April right now, 2026. And so that's where we're at today. And so we have tons of lessons we've learned in helping people going through our program. We're doing one-on-one coaching with them. We're doing group coaching with them. We have a private community where they're communicating with each other, and our staff is in there answering their questions as well. And there's some great themes that I pulled out, and I was just making this help spectrum so that I can help you guys out. But I'm going to complete it here in a second. But before we get into more details on all these things that I learned that I'm going to share with you, let's see who's here today. So if you guys type in the comments and let us know where you're from and who's here. Who have we got? Julie Parker's here from Sydney. Fantastic. Hey, Julie. Thanks for joining us again. She's a regular. Taben is here. Hi, new follower from Texas. Fellow Texan. Fantastic. What's in that picture? Oh, it's somebody kicking up their feet. That's cool. We got somebody from Facebook. We're live on YouTube, Facebook, and also Instagram. Can't see your comments if you're on Instagram, though. Dr. Lyons. Oh, Dr. Lyons has a pretty new updated picture there. Fantastic. She says, hi, Dr. Dave and everyone from Los Angeles. Excited. Welcome back, Dr. Lyons. Happy to have you. Maina. I remember Maina. Hey, Maina from India. I am feeling improvement in my knee pain after doing glute exercises. Yay! Dr. David, happy face. My only problem now is a knee pain when I go down the stairs, not when I go up. Please, guide. Thank you. Yeah, that's an easy one to answer. That's super common, Mina. Once you start to activate the glutes, once you turn them on and you've figured out how to use them as you're walking and doing things, knee pain gets a lot better. Going downstairs is typically a lot harder than going upstairs because of the control that it takes to stop yourself. And the way to get over it is to get more glute strength. Let me say that really clearly again. The stronger your glutes are, the better you will feel going downstairs. It's not going to be an instant fix. There's not like a trick that you're missing. It's just good old strengthening that will help you go up and down the stairs, especially down the stairs, without any knee pain. But you're on your way, Mina. Great job. Who else is here? We have Lori. I need to find someone like you out here in Carrollton, Georgia. Oh, she's got another comment. 2 years ago, I fell down a couple steps forward. Oh no, landed on my hands and knees on concrete. A year later, I went to the doctor because my hips been getting really bad. So I had hip arthritis. Oh no, I'm so sorry, Lori. That's not fun. Yeah, that'll set you off for sure. Hopefully we can help you out today. I think we will. There's a lot of great information. I was just building my spectrum here as we pull up another comment. I'll finish it off, but we have one. Santosh says, hello and well been to you all. Fantastic. Great. Thanks for joining us, Santosh. Kimberly's here. She says, hello, Dr. David and everyone. Welcome, Kimberly. Thanks for joining us again. Lori says, doctor said I have hip arthritis after my fall and scoliosis, which I feel my hip and pelvis are cockeyed. When I sit, my one part of my pelvis doesn't want to sit right. Yeah, that'll happen. I'll touch on that today for sure during the talk of how the pelvis, the hip bones can shift as a result of some of the problems that set up hip arthritis. And so it's all interconnected as far as how the process works. I'll explain more about it as we go through today's talk. Thanks for joining us, Lori. Can't wait to help you here. Kate60 says, good afternoon from Richmond, Virginia. Welcome, Kate, representing the East Coast. Victor's here from Springfield, Massachusetts, having an excellent day with the hip. Great to hear, Victor. I'm glad you're doing well. That's fantastic. Melissa says, hi from Philly. Philadelphia's in the house. Georgia. Oh, that's where Lori's from. Georgia. Fantastic. Great. Taben says, I've been having knee pain when I've been having knee pain. I went to doctor, took x-ray, came out normal. Yes, that'll happen. That's a good thing. That means that your knees aren't that bad yet. The fact that there's pain, though, is your body letting you know something's wrong. Something needs to be fixed. But the fact that your x-ray isn't showing any bad things yet, it looks normal, That means that you need to fix it now before you do start getting signs on your x-ray. And just for everyone's knowledge, it's okay to have things come out on your x-ray. You can still very often fix a knee pain. It doesn't mean you're going to have problems the rest of your life just because there's signs of arthritis or some abnormality on your x-ray. Awesome. Sharon says hi from Kenya. Awesome. Africa's here. I haven't seen Africa in a couple weeks now. Thanks for chiming in, Sharon. Cindy King says, good afternoon from Odessa, Texas. Hey, Cindy. Thanks for joining us, our fellow Texan. Las Cruces. That is the closest we've had in a while. Lalan. I can't pronounce it. I'll just call you Lala. Lala is in Las Cruces. That's like less than an hour away, just down I-10 from us in El Paso, Texas. Mimi says, Sylvia in Spokane, Washington. Hey, Sylvia. Thanks for joining us from the Northwest. Shirley is in Central Iowa. Thanks for coming in, Shirley. In the middle of the country in Iowa. Kit Kat, the most valuable advice is from you. 1, glute max activation, not glute medius. Yes, and I'll talk more about that because we can separate all the glutes. I don't think we have to, but if we just think about extension rather than abduction, which is the idea behind glute maximus versus glute medius, that is key. And then 2, glute quad ratio has to increase. Avoid quads biasing at any cost. Yes, you're thinking about this right, Kit Kat. 3, 2 steps ahead, 1 back, but the trend matters. Yes, it's not a perfect linear improvement. It's going to be kind of up and down. I love this graph. I'll just draw it out real quick for you. It'll be super fast. So most people want this. This is what we want. Is for improvement. If this is timed this way and improvement here, we want improvement to just be like that. Like every day is better than the last day, but the reality is this. It's like this and goes all over the place. But as long as we're trending in the right direction, that's good. But your day 2 might be better than your day 5, but your day 10 could be even better than these 2 days, but it doesn't feel, when you're in the thick of it, it doesn't feel like you're making progress at times. But if you're sticking to the principles that we talk about here with glute activation, like you're saying, you're going to meet the outcome. So good job there, Kit Kat. That's fantastic. Excellent work with that. Who else is here? Linda Arnold. Have family in El Paso and raised in El Paso. Oh, cool. Went to Irvin High School, but now live on Whidbey Island out of Seattle. Very cool. Well, I hope you're enjoying the Pacific Northwest. Irvin High School is still humming along. We will be there sometime soon for a track meet for my kid. We're still here in El Paso. It's fun times as well. Nice and warm. Salsa Louise says, hey, from sunny Scotland. Awesome. UK's in the house. Cape Town, South Africa. Another African is joining us. Great. Thanks for joining us, Moni. And then Lori says, I have been watching a lot of your videos lately. Great, Lori. I hope it's been helping out. I hope you've been applying things. That is the biggest thing. I'll talk about it on this list here. Learning this stuff is critical. Then comes application. And so that's the key thing here is we've got to bring this all together. Julie Parker says, what is a good exercise to help strengthen the hip muscles? Oof. That's a loaded question, Julie. You want to get into it? Let's get into it. So let me complete the help spectrum list here that I was talking about and just explain this to you. First off, let me just start from scratch here. So here are 10 things that I learned after helping 2,164 people with hip arthritis. These are numbers we pulled out of our database for our hip arthritis recovery program. And what I've got for you here is the help spectrum. So on this end of the spectrum, we have long-term help. Then in the middle, we have short-term help. And then on the far end over here, we have harm. The opposite of help, actually. So things that harm you. So these are where we want to live, right? Things that give you the best long-term benefits so that you're not dealing with hip arthritis problems for an indefinite amount of time. So you fix the problem, essentially. Short-term help could be beneficial because that could get you better sleep tonight or to walk better today and allow you to get some things done that are important. You definitely don't want to be doing the harmful things. For some reason, there's still beliefs in the medical field that there's certain things out there that are supposed to be helpful, but they actually end up being harmful. And I'll talk about those today too. So let's get started with number one here on my list of the things that I've learned in helping all our people with hip arthritis problems that have been in our programs. And the number one thing, this is the most important thing by far, and it is research backed. Like I've seen this in research studies time and time again. It's part of like arthritis best practices across the world and arthritis organizations. It is that education matters more than anything else. In other words, being educated about how hip arthritis works, what is happening in your body that is causing hip arthritis, having knowledge and understanding about that is the number one thing that can empower you guys to fix hip arthritis and avoid having a hip joint replacement. And so with that being said, here's the kind of education that I want you guys to learn. I truly believe that the concepts that I talk about in this channel, and I'm going to explain it here in a moment, is the cure for hip arthritis. And that is fixing, I'll just say fix the muscle imbalance. Knowledge of the muscle imbalance is so important. I would say it's the most important thing, because we have people that join our program, and one of the first things that we tell people when you're in our program is you need to take tests. Now we have phase 1 for free on our website. I'll tell you more about that a little bit later too. But that isn't the whole, that doesn't give you access to the tests. Once people join our program, one of the first things we're telling them is go watch all the videos for our program, because I need you to learn to get educated about fixing the muscle imbalance, because that's what's going to cure the problem. Said differently, if we say it backwards, having the muscle imbalance present in your hip joint is what is causing the arthritis to progress over time. It's not age. It's not that you have old bones or old joints. It's not wear and tear necessarily. That's kind of part of it, but the wear and tear is happening as a result of the muscle imbalance putting extra forces in a bad way through your hip joint. And if we can fix the imbalance, despite you getting older and despite you continuing to be active, wear and tear, you can actually feel better. So I strongly believe that this muscle imbalance concept and fixing it specifically is the cure, but you have to learn about it. And here's the kicker. Nobody that you go see, it's extremely rare, nobody that you go see in person for hip arthritis help, like your doctor, your physical therapist, your orthopedist, all those guys, they are not going to talk to you about the muscle imbalance. It is not something that's taught in medical schools, physical therapy schools. It is not common knowledge. It's something that I've been pushing for a long time, and I'm going to keep pushing it until my days are gone here, because I've seen it play out so many times in all these people that we've helped. And some of you guys watching right now are already saying, like, I started working on my glutes and my knees are better, my hips are better. Even though I was scheduled for surgery, I don't feel like I need it anymore. I'm going up and down stairs better. The last thing left is going downstairs. People will say things like that because we're fixing the imbalance and we're taking care of the root problem that's causing arthritis. So this is the cure. So let me tell you, in case you've never, this is the first time you've met me before and you're not sure of the muscle imbalance, let me show you what I mean. Let's go to the skeleton. All right, y'all got to follow me here. I'm going to go through this kind of quick, and you guys need to ask questions in the comments if you are confused about this so that we can make sure to clear it up. I don't think we're going to be able to get this out of the way today. Sometimes my skeleton wants to cooperate with me and sometimes not. So we'll just have an arm in the way. All right. So here's the hip joint. It's the ball and socket. You have the thigh bone, which is called the femur, and then that makes the ball. And then on the socket side is this pelvis bone, which it's all kind of one unit. There's joints in there, but we treat it as a unit as far as how we look at the pelvis bones. Now on the back side of these bones, you have glute muscles, butt muscles for the the slang term, but in the medical term, we say glute muscles. And there's a bunch of little muscles that make up the glutes, with the gluteus maximus being the biggest one back there. And that's the one that I'm usually interested in most, is if we can get that gluteus maximus muscle, it connects from the rim of this bone down this way, and then it rolls out this way, and it connects to the outside of the thigh bone right here, so it crosses the hip joint. Its job is to extend your hip, and it helps to control the ball within the socket. It properly positions it along with all the other glute muscles in the center of the socket, so that the mechanics, the way that the ball and socket joint work together, so that the mechanics are optimized. It's working well. On the front of the joint, we have hip flexor muscles. These are muscles that start on the inside part of this bone. There's some that run up to the bones of your lower back, the psoas muscles, and they run down over the front of your hip, and they go kind of towards the inside part of your leg, and they attach to this little bump right here. It's called the lesser trochanter of the femur. And when it shortens, when these muscles shorten, it pulls your knee upwards. It flexes your hip. So these two muscle groups work together to create hip movements. You also have some muscles that are kind of on the outside that help move your leg outwards, abduction, and the front half of those muscles can assist with hip flexion, and the back half of those muscles can assist with hip extension, moving your leg back. In the medical field, what people often get told when they have hip arthritis is to just exercise all of them, because the belief is that any exercise is good and helpful for hip arthritis. What I'm saying that's different is that you have a muscle imbalance if you have hip arthritis. And that muscle imbalance is that your hip flexors on the front of your hip, the muscles that are relatively on the front side of that hip joint, have become over dominant. They're being overused. And the muscles on the back, the glute muscles, the butt muscles, have become underdominant, underused. Therefore, at the ball and socket joint, the forces from the front and the back are not balanced. It's too strong on the front, too weak on the back. So what that ball and socket joint does is it gets shifted forward. It moves slightly forward in the socket. And if you're walking like that, if you're moving like that, going up and down stairs, doing the laundry, doing the dishes, walking around your house, working, all the activities that you do now are in a malpositioned joint. And it's causing that wear and tear that people talk about. But it's not just wear and tear for no reason. It's because you got a muscle imbalance. And if we can get those glutes to work better and get these hip flexors to calm down and normalize the position of the ball in the socket, now you can have very normal forces going through the joint, and it can heal and you can feel better, and we can stop progressing hip osteoarthritis. That right there, if you can wrap your head around that, you might need to replay that section of the video. You might need to go back, scroll back. If you didn't get that part, that is the education piece. Let's come back over here. That is the education piece. That is the cure. Once you get that, then you begin to understand, oh, okay, so that's why I need to activate my glutes when I do this thing, or that's why when I do a certain movement or an exercise and I feel my thigh muscles or my quads or my hip flexors in the front of my hips working too hard, it's because of the imbalance. Once you start to connect those dots in light of the muscle imbalance, then you can begin to make slight tweaks, slight changes in your everyday life that add up to a massive long-term difference that prevents your hip arthritis from getting worse, prevents you from getting a hip joint replacement, and sets you up to heal for the long term. This is the absolute number one thing that everybody needs to go through. Like I said, it's so important we test people on it. You go through our program, and the first thing we tell you to do is you got to pass that test. And we let you take as many tries as you need to. It's not like a high-pressure test. The main thing is we want to make sure that you understand this imbalance, because then we can move forward in the right way. We can do the right exercises, and we're not taking all these detours, chasing things that are really short-term or even harmful. All right, so that's number one. Let's go to number two. It's related to this. And I've already kind of been mentioning it. Glute activation is king in the beginning, because in this, I'll just write active, because in this muscle imbalance concept that I'm telling you about, glutes are often weak and shut down. And the biggest problem that I run into, this is one of the things that I learned, is that some people cannot even activate their glutes. And you might be one of them right now. You might be watching me. If you think that you don't have active glutes, or you can try this just to make sure as a test, wherever you are, whatever position you're in. I'm standing right now. If you're sitting or lying down, this will work too. If you just close your eyes and think to tighten your butt muscles, like make them flex, make them tension up. If they actually tension up, you can put your hand on them and you feel and hold it, and you feel them starting to get a little tired, then you have glute activation. That's good. But what often happens in people with severe hip arthritis or chronic hip arthritis, either one of the two, or they cannot get their glutes to fire. They'll put their hands back there and they'll say, I don't feel it. And I'm trying to hold it. And actually, I feel my thighs getting tired. If that's happening to you, you absolutely have this imbalance. And it is critical right now that you activate your glutes and you figure out, you go through the process of learning how to make your glutes work when you tell them to. This is one of the biggest problems that I find in people. And I truly believe that there's so many people that are scheduled for hip replacement surgery right now that if they just went through finding their glutes and activating them and beginning to use them better, they'd probably cancel their surgery. And if they took it to the extent that you can go and fully fix the imbalance, you'd be curing your hip arthritis. You wouldn't be worried about it this time next year. You wouldn't be considering going to the doctor for injections or talking about surgery to them if you fix this the way that it needs to be, if you go through the whole process to get your arthritis problem addressed for the long term. Glute activation is critical, and so many people don't do well. And we have people going through our program that are confused. They're like, well, do the glutes even? Are you guys lying to me? Is this because they'll type this in the private community? They'll say something like, I think this is a sham. And then we have other people chime in that say, no, I actually figured out how to fire my glutes and I'm feeling way better now. And then we have people that figure out how to fire, they get obsessed with it. I tell them to. I tell you guys, you need to get obsessed with using your glutes, because if you're not actively using your glutes, by default, your body figures out other ways to just move, other ways to live your life and do things. And it's probably with those hip flexors, the muscles on the front of your hip. And so it's pulling the ball forward into the socket and causing the joint to rub inappropriately. This is not taught in physical therapy. Many of you guys are going to physical therapy. You just told, jump on the treadmill, let's walk. Get on the bike, let's walk. Do this exercise, do that exercise. And there's no instruction, there's no slowing down to start to ask the questions of, do you feel it in your glutes? Are you activating your glutes? Is it more this muscle or that muscle? There's no connection as to if the muscle imbalance is truly being corrected. There's no consideration for that. And that's why many of you guys go to physical therapy, or you're trying exercises on your own, those general exercises, like I said, and they're not effective for you. In some cases, making it worse because you're actually skipping using your glutes, using the hip flexors, and irritating your hip joint in hopes that you're fixing it. It's now become a harmful thing for you. All right, number 3. Here we got abs. The abdominals need to be active too. I'm going to go back to the skeleton for this one because it's kind of the deeper cut on this muscle imbalance. All right, so I explained how the muscle imbalance works between the glutes and the hip flexors and how it changes the position of the ball and socket joint, and that's what's changing the mechanics and causes extra pressure. But if you think about the abdominals, talking about the ab muscles, they live on the front side of your body right here. Very important in many ways. As it relates to hip arthritis, the way I want you to think of it is those abdominal muscles attached to the edges of your rib cage, all right here. They have tendons that go to your spine, and then they have attachments to the edges of the rim bone right here in front of the pubis bone, all the way, and it covers this whole space. It makes up your abdominal wall. One of its responsibilities is to hold your guts in. Sometimes people have hernias and they're not doing their responsibility anymore. It's often because you got weak abs. And when we talk about abs, I like to split them into an upper half of the abs and a lower half of the abs. And the halfway point is where your belly button is. So if you just put your finger on your belly button, as long as you have a normal belly button, it should be about this point. And so everything above the belly button is your upper abs, and everything below your belly button is your lower abs. What I specifically want people to do when they activate their abs is to get more activation in the lower abdominals below the belly button. And the reason is because those muscles attach to the rim of this pelvis bone on all the way down here, all the way on both ends right here. And so when you have better activation in those lower abdominals, what happens to these pelvis bones? Remember I said they get treated as a unit. It pulls the front end of the bone here upwards like that. And when you pull those bones upwards, what it does for your glutes on the back, see, I'm going to pull them up. It puts the glutes in a relatively shortened position with their attachment down here on the thigh bone, and it makes your glutes work more efficiently. You get a better activation out of your glutes. Glutes and lower abs work together to help your hip joint work best. So that's why a lot of people will get a big improvement once they just find their glutes, but they'll get even better for the long term when they get their abs involved. And a nice side effect of this is when you get your abs, your lower abs stronger, it often is offloading a bunch of back problems, because it's very common for people in our hip arthritis recovery program to also have lumbar stenosis problems, herniated discs, pinched nerves, sciatica, all kinds of back problems that are associated with those weak lower abdominals. And we hear them in our program say, my sciatica went away. I don't feel like I have any back pain anymore. My hip's better and my back's better. What a nice side effect. It's connected the way that this muscle imbalance works, because it's offloading your spine in addition to fixing the mechanics at your hip joint. It's the way our bodies are designed to work. So that's why the lower abs are so critical, and they are important for the long term. If you fix these things, these are your highest value activities that you should be doing if you're trying to avoid a hip replacement surgery to fix your hip arthritis problem for the long term. Long term. It takes time and effort to do this. You have to carve out time on your schedule. You have to commit to the process. It takes months, if not the better part of a year, in some cases over a year. It just depends on how severe your muscle imbalance is. This is cool. One thing that I found with another thing, just a side thing, I didn't plan on having this in the list, but I've looked at many MRIs and x-rays of people with hip arthritis, because they requested I take a look at it. And I have seen that there is not a correlation between how severe the x-ray or the MRI is and how long recovery takes. Let me say that again differently. In somebody with a severe looking x-ray or an MRI, it doesn't always mean they're going to take a long time to recover. They might have a beautiful looking MRI or x-ray, minor arthritis, and they could take a long time to recover. The factor that I've seen the most, what I've learned, is it's the severity of the muscle imbalance. And the way that I'm catching it is when they're saying, I can't find my glutes. I'm having a hard time. It's been 2 weeks and I still can't find my glutes. I can't find my abs. I'm not understanding the muscle imbalance concept. I have a lot of questions. And it's okay. I tell them, this is good. We need to wrestle through this. You need to learn this stuff, but just understand it's going to take you a little bit longer than other people, even though your x-ray isn't that bad. And then we have people on the other end where their x-ray looks terrible. And I'm even telling them this program might not work. We can give it a shot, but let's see how well you can get your glutes to activate. And once they start, they're like, oh, I got my glutes to activate. My abs are activating too. I'm obsessed with this. I'm doing it all the time. They're saying I'm feeling a lot better, even though they had stage 4 osteoarthritis and the doctor recommended they should have had a joint replacement last year. So it's more muscle imbalance severity than it is x-ray severity. This is my observation, okay? I'm speaking as an expert who's been working with people in our hip arthritis recovery program, and this is what I've seen. This is why I point my finger to this and say, this is the cure. It's muscle imbalance. There's a direct correlation that I'm seeing in severity of muscle imbalance with how long it takes to recover. All right, let's see what questions you guys have so far based on all that I've said. I've got a lot more to share, but I want to take it in chunks for you guys here. What questions do we have? Dr. Lyons has a question. I started out not being sure I could activate my glutes, but using all I have learned here, I can absolutely flex them and each one independently. Progress. Yes. Good job, Dr. Lyons. That's how it should be. So many people have trouble. when they see our videos, they're often, I think, stunned and shocked for the first time. They're going through what we call cognitive dissonance. Maybe you know about this, Dr. Lyons, where they're like, wait a second, I didn't even know this was a thing. This is altering my reality of life. I didn't know that you could flex your glutes, that was a possibility. And then once they start to do it, it becomes more natural over time. And it feels very unnatural for people at first, simply because you're not used to it. But my ask of people as they go through our program, I'll show you this is the chart we use in our program. This is the hip arthritis recovery program phases chart, which I'm going to talk about more here in a second. But one of the criteria for each of the phases is how well you can activate your glutes. Some of you can see that there. It says glutes. Maybe you can see it better there. And then there's glutes in every column. And the reason for that is because you should be able to flex your glutes at different levels as you go through the phases here. And what you're talking about, Dr. Lyons, is being able to flex your glutes left and right individually. That is very necessary to progress through the phases here. You have to progress the quality of you firing your glutes, the intensity that you can fire your glutes, and the endurance in your glutes in order to get to phase 4. Great job, Dr. Lyons. Love it. Who else has a question? Krissa. Krissa says, hello, after scoliosis surgery, they x-rayed my whole body and told me I have AVN, that's avascular necrosis in the left hip. Can I work on glutes or too late for me? So with avascular necrosis, that's potentially a chronic problem that you're going to have. We do have people in our hip arthritis recovery program who have AVN, but we always tell them, look, the results are not going to be like somebody who wouldn't have AVN, but I think it's worth a shot for sure. So I don't think it's too late for you. In fact, I think that it's probably the best thing for you, because if the prognosis, or let me use a better word, the future outcome of what we'd expect in your situation is that it's only going to get worse, no matter what you do, because that's what doctors are probably going to tell you. They're going to say eventually you're going to need a hip replacement if you have AVN. Then I would try to avoid that, and I would do some glute work to optimize the pressures inside the joint, because potentially there's a possibility that those bad pressures you've had in your hip joints contributed to the AVN. I can't say that that's the case for sure, but if there's no loss in getting stronger glutes, in other words, if there's nothing to lose because you're getting stronger glutes, heck yeah, you're going to walk better, you're going to move better. If potentially it also helps out your AVN, why not? Plus the aesthetic benefits, who doesn't want that part, right? It's a win-win-win. Just strengthen your glutes. I feel like you would think that this is an easy argument for people, but I think where the lose part is you got to do some exercise, you got to sweat a little bit, you got to commit to this. I think that's the part that people have the most trouble with. But I'd go for it, Krissa. I'd do some glute strengthening and just monitor your hip condition, make sure it's not getting any worse. And you do have to figure out how to grade the glute strengthening. In other words, how to start easy and work your way up to the harder exercises so that you're safe. Good question, Krissa. Kimberly, she says, since my broken hip and not using my leg for 8 weeks, I still, after 1.5 years, can't feel the muscle burn. I can activate my glutes, but they don't seem to get tired like before. Well, that's good that you can activate them. That's definitely a huge win. I wonder then if perhaps you actually have good strength and you're just pretty strong and you just can't get them to tire out because they last as much as you need them to. I've had that happen in some people. That would mean that you probably need to increase the intensity somehow. So you might need to add weights to some exercise that you're doing. You might need to do faster reps. If you can consistently tighten your glutes on an exercise, then that's when we move from doing holds, because we often tell people hold it for 10 seconds. And the reason for that is because we're trying to get the brain to connect to the muscle better so that you can more consistently fire the muscle on conscious command. But once you've gotten good at that, then we want the reps to come back where you're doing like squat reps, for instance, but you're consistently using your glutes and not defaulting to hip flexors or quad muscles. And that higher repetition exercise might be what needs to happen in order to get the muscles to burn again. It's going to change the effect on the muscle. You might need to add weights in that scenario too. So it might be time to progress in that way if you're sure that you're consistently firing your glutes as you wrote here. Good question, Kimberly. Lala says, I'm almost 100% sure the elliptical caused my muscle imbalance. Is this possible? I used to use the elliptical 7 days a week for an hour, 4 miles. It could be. And you know what? It's not that the elliptical was bad, it's how you were using the elliptical. Because if you weren't sure of your glutes activating during the elliptical, which is possible, I've had people do that all. I think of one client in particular who loved using the elliptical, but it would kill her hip pain. She had a labral tear and was starting to get hip arthritis in that hip. And she was like, I can't use elliptical anymore. And I told her, back off the elliptical for a bit. Let's figure out how to use your glutes. We went through a month or two of doing that. She got it. She got obsessed with it. She loved wearing her heels. By the way, we switched to the tennis shoes, the flat shoes for a while she figured out her glutes. Then she figured out her glutes. We got back onto the pumps that she was using, the short heel, and she got back to the elliptical. But now what I told her is when you use the elliptical, when you're pushing down on the pedal, you should feel your glute contract. Glute contract. Every single time you should be alternating glute contractions like when you're walking. Once she got that, elliptical was no pain for her at all. In fact, I told her now it's working for you, because she'd get off the elliptical and she'd say, my butt is tired. I feel like I'm going to cramp sometimes in those muscles back there. And I feel like I'm getting sore in those muscles too. And I can tell I'm getting stronger, and my hips feel fine the whole time. So I told her, fantastic, great. And related to stairs, because we had stairs comments earlier, that woman was going to sell her house because she had stairs and she could not go up and down the stairs all day. Her bedroom was upstairs, and she said laundry was the worst because she was going up and down stairs to, work through laundry. And she was looking to sell her house to get a 1-story house. Seriously, looking like it was about to be listed on the market. Once we fixed her hip problem, stairs are no problem anymore. She had to get stronger, but she can go up and down stairs without hip pain. It's just a matter of making sure that you learn how to use your glutes properly on the elliptical, and that you get more strength over time in those glutes. Good question, Lala. Got a 2-part question coming up next. Lori says, I've had so many surgeries on my lower abdomen for different reasons, to not to go into here, but I feel I can't get my abdomen to work to get them stronger. I have a fusion at my L5 and S1 that keeps me from doing a lot of the exercises for the lower abdomen. Yeah, that's a tough one. My answer to that is do what you can, because there's a difference between my lower abdominals don't work at all, like 0%. I can't use them at all. And that's one way of thinking. The other way of thinking is my lower abdominals have 25% use. They do work, they just don't work well. I suspect that's the case with you, is they do work, they just don't work well for you because of the surgeries and all that. In that case, which I'm assuming that's your case, is I would work with the 25% you got. Because let's just say there's some of your ab muscles that are just never going to activate, but there's other portions that are. Let's strengthen the heck out of those portions that are, so that they can compensate and make up for the ones that are not. You might just take longer. It might take you more effort than somebody else, but this is the body that you got, and hopefully we don't get more surgeries. And plus, we're interested in long-term relief, not short-term relief, which, by the way, surgery is in this list. I'll talk about it at length here in a second. I want you to fix the long-term. And so I'd rather you not just give up on lower abdominal strengthening and throw in the towel and throw your hands up and say, that's it. My abs are shot. No, you got something in there. You just got to work with it. You can do it. So get those abs strengthened up. Let's get you on. Let's get you on board and work in the abs. You got to start it though. All right, guys, we're going to talk about the hip arthritis recovery program. I want to let you know that it's a paid program. I'll tell you more details about it here in a second, but you can get phase 1 for free today. So you just got to go to our website, and you can see on our website right there on the image, you just hit the play button right there, and that's phase 1 right there. It's already playing. You can scroll and see other videos on there. Go to our website right there, and you can start the program for free to make sure that it's right for you before deciding to commit to purchasing it and becoming a member of the program. That's why we set that up there, and you're going to get helped. A lot of the stuff that is covered in phase 1 is beneficial to everyone. I mean, there's people that join our program, they think they're in phase 2 or phase 3, and we're pointing them back to phase 1 because it is that critical. So our website's listed down there. If you go down there, you'll see start the hip arthritis program for free today, and you can begin to watch the videos. So we just put that out there for you guys because we know that you all need it. It's help that you guys need. You're going to benefit from it. Go check it out. All right, let's come back over here. Let me just get a swig. Let's keep going. Speaking of phase 1 and the hip arthritis program, it is important that, all this stuff that I talked about in the long-term side, you might not be able to do it right now. Like you might not be able to do much with your glutes or your abs because it's very possible that you're watching right now and your pain is a 11 out of 10. It's up there. You're having a hard time even just getting comfortable right now. And so in phase 1, a short-term activity that we talk about that's critical for, I'd say 90+% of people going through our hip arthritis program, it's offloading. This is what I've learned in taking people through our program is that people don't offload enough. And when I'm talking about offloading, let me grab what I mean here. I'm talking about using this device. Offloading literally is taking weight off, taking a load off your hip joint. And people fight us using the walker, getting the walker out. And it's, and I understand it's cumbersome. It doesn't allow you to walk very easily. But if you think of all the steps you take, you probably take thousands of steps. You spend minutes, if not hours, on your feet throughout the day. All those steps with your ball and socket joint in a bad position because you have that muscle imbalance and it's not fixed yet, you're irritating the joint and continuing to walk on it in an irritated state. If you like right now, if you stand up and it hurts, it's irritated already. And you're just making it worse. You're picking at the scab every time you continue to walk on it. And this is why many of you guys feel worse by the end of the day. But if you get this walker out and start leaning your body through it and you take off 20, 40, 50% of your body weight as you walk, and I'll show you how I use it here on the side camera. You just have to have it in front of you here and you move forward and then it looks like I'm taking normal steps here, but every time I step onto my left leg here, I'm pretending this is my hurt one. I'm putting more weight through the walker as I step with my left leg so that I'm not putting my full body pressure onto that hip joint. Now, the walker's the best in my opinion, especially if you're very severe in your discomfort, in your pain. But you could accomplish the same thing with crutches. Now, I don't have my other crutch. We must have lent it to somebody. We have people that need them all the time in here because I promote offloading so much. But ideally, you would have 2 crutches and you'd be using 2 crutches to accomplish the same thing, not put your full body pressure through that hip joint. This is incised to me. Somebody else is using it. We're using these things all the time. And then a lower tier offloading tool would be the cane. So the cane, you put it opposite the side of the one that you want to offload because that way if my right hip is fine, I could balance on it. But when I step on my left leg, because my left hip is the problem here, I'm pretending, of course, I'm putting some pressure on the cane so that I'm not putting my full body pressure on that left leg as I walk. It's the same idea with the crutch and with the walker. The point, though, that I'm trying to drive home with you is that if you can offload right now in the short term to get the pain to calm down, that will set you up so that then you could do glute and ab exercises and it's not painful for you to do them. People do this backwards often where they're trying to do the exercises first. They're in an immense pain right now and they're trying to do exercises and it's actually hurting. And we even have some people that say, well, you say to do glute exercises and you say to do ab, and I'm trying and it's just making me worse. And we have to go backwards and say, wait a second, does it hurt to walk around right now? Oh yeah, you need to start here. You need some short-term pain relief first. And this is natural. There's no medications, no injections. It's just mechanical offloading. The problem is just being adherent to it. In other words, committing to doing it. That's the biggest problem we see with offloading is people are like, oh, I don't want to get a walker, and I'm gonna have to explain to everybody why I'm on a walker, and people are gonna ask questions, and I'm not gonna fit this in the car. I gotta take the bus. I gotta work still. All my coworkers are gonna people raise all these concerns, and I get it, but I'm like, what would you do if you had cancer? Maybe you have. It stops you in your tracks, and you have to go through the treatments. You have to go through chemo or radiation therapy, whatever your cancer doctor recommends, and they don't give a flip if you're working right now or if you have to commute by bus or whatever it is. You have to treat it with the same seriousness. What if you had a heart condition and they were like, if you don't take this medication or do this treatment, you're not going to make it to next week? We don't treat hip arthritis with the same kind of urgency because we have that surgery to fall back on, the joint replacement. Say, well, if this doesn't work, I'll just get it replaced. But the reality is it doesn't fix it for everyone. Some people have a good outcome. Some do not. And you don't know which one you're going to be right now if you haven't had the surgery yet. And then you would be able to hedge your bet. You'd be able to go into the surgery a lot more confident if you first go through this stuff to see if it's going to work. That's why we have phase 1 for free for you guys. And we have a lot of people that do phase 1. They're like, wow, this offloading stuff is amazing. I'm getting my glutes to work. We're on the right program. That's what we need you guys to determine. And some of you guys are like, no, it's not working. And we'll talk to you guys on the phone. You know, at some points you all get in touch with us, and there might be some situations where we need to recommend you do need a hip joint replacement surgery. But for the vast majority of you guys, you don't. You just need to go through the right process to get your joint offloaded, then get to the right exercises. Offloading, guys, is so huge. One of my favorite short-term relief treatments that you could do. All right, next one. Oh, I love this one. I get excited about all this stuff. Muscle imbalance, MI, so the education part, is more important than weight loss. I love this because a lot of you guys have been to the doctor to get your diagnosis for hip arthritis, and one of the recommendations your doctor will probably make is you need to lose some weight. You go online and Google treatments for hip arthritis, and in the recommendations, besides, you know, exercise and taking some medications and injections, it's going to be weight loss. And a lot of times people even spit out numbers because there's research studies that have connected some dots, and they'll say, well, for every pound you lose on your weight, it's 4 pounds off your hip or your knee. And they make this math, and then you start to do the math in your head, and you're like, well, I got 40 pounds to lose. I got 20 pounds times 4. That, oh my gosh, that's so much weight off my joint. And yes, it can be effective. And we've actually even learned in helping all our people that the number that we're using, let me tell you the number that we're using. We're going off of BMI. BMI is body mass index. It's a number that you can calculate based off your weight and your height. It's a ratio to figure out how obese you are. There's scales on this. Would you mind pulling up the picture of that, by the way, while I write this? The magic number we're using is 35. If your BMI is less than 35, you're good to be in our program. But let me just show you here on this chart that you're seeing on the screen. The blue section on the bottom is underweight. That means your BMI is under 18.5. Normal, that green strip that goes along the middle, is a BMI between 25 and 18.5. Overweight is between 30 and 25. People that are overweight, according to BMI, we still think they should be working on the muscle imbalance and not on weight loss. Then the red section on the top of the chart, on the top left, is the obese section. And what we have found is that people with a BMI of 35 or lower, so even if you're 30 to 35, you're technically obese, you can still get a lot better by going into our program and fixing your muscle imbalance before you lose any weight. You can take it off. In other words, you can be the edge of obese. You can be on the edge of obese, 30 to 35 range on BMI. And I still think it's better for you to work on the muscle imbalance instead of weight loss. Now, above 35, it is absolutely important for you to focus on weight loss.
That's a critical distinction here. And the reason why I say it is because we have people that we talk to all the time that say, well, the doctor said I should lose 30 pounds. We calculate their BMI and they're actually below 35. They're like 30, upper 20s. And to lose those 30 pounds is going to take a lot of effort because it's the last 30 pounds. Versus if you're 100 pounds overweight, yeah, you need to lose some weight first, and that's going to be your priority. But if you're under 35 BMI, I would prioritize fixing the muscle imbalance, because if you can do that, then shedding any weight that you want to lose is going to be a lot easier because your hip's going to feel better. But if your BMI is above 35, then what I would recommend you do is go talk to your nutritionist or the right doctor to help you drop some weight and get your BMI at 35 or lower. Then at that point, let's focus on a program like mine, the hip arthritis recovery program, or implementing these activities like I wrote here, getting your glutes to activate, your abs to activate. Now you can work on it at the same time, but I would rather, we've found that we have hard data that shows that if your BMI is too high, above 35, you're not going to do great in our program because you need to lose some weight first. That needs to be your priority before you join our program. So I love this. Once we determined that, it was clear in the data, we were like, okay, let's start telling people, go lose weight first. It's going to be your best thing to do. As a medical professional, sometimes I need to break the harsh reality that maybe other medical professionals have already told you, that you got to go address the weight. And there are so many solutions out there these days. You need to find the one that works for you so that you can address the weight and then go address the hip arthritis problem for the long term. We can help you after that. So that was number 5. Number 6 here. Oh, this is actually not in short term. We're going to go back to long term for number 6. Number 6 is going to be over here, and it is weight training. In other words, lifting weights. We have found, not surprisingly, that weight training, adding weights to your exercises eventually, when it's right for you, after you've been offloading, after you've gone through activating the glutes and activating your abs, once you're consistent in using the right muscles, once you've figured out walking stuff, which I'll talk about in a second, adding some weights, and I'm talking small weights, the pink ones, the 1 or 2 pounders, 5 pounders to start. If you can go up in some weights beyond that, maybe 10 pounds or 15 pounds, it is even more beneficial for specific exercises that we talk about in the hip arthritis recovery program, specifically glute exercises. And one of those is going to be like squats. We talk about doing some mini squats that don't hurt your hips. By the time we put it into the program, you should be activating your glutes very well. You should not be irritated because you offloaded. And including weight training, which the difficulty that we run into is we have some people in the program that are not, how do I put this nicely? They're not familiar with weightlifting. They haven't worked out ever in their life or in a very long time, and they're kind of averse to it. They're like, "Oh, do I have to do that?" And we have to tell them, yeah, in order to become a person that does not have hip arthritis problems into your 60s, 70s, 80s, and beyond, you have to include some sort of regular weight training routine in your weekly schedule. It doesn't need to be a grand, weight trainer and all these free weights, and you have to have a committed gym membership. You can if you want. But if you just get some free weights for your home, you tuck them under your bed and you take them out for 20 minutes a few times a week, that goes a long way in maintaining your hip health so that you're not getting a hip joint replacement later. Critical weight training. But that comes later. That comes in, let me show you on the phases chart. We don't add weights in our program until phase 3, and then we're doing it in the maintenance section in phase 4. But in phase 1 and phase 2, there's no weights. We need to first figure out how to calm the pain down here in phase 1 of the hip arthritis program. And then in phase 2, we're making sure the right muscles are firing without weights. It's not until phase 3 that we're adding some weights in. But those weights will get you into phase 4 and allow you to maintain in phase 4 so you're not regressing all the time, as we see a lot of people do. They'll do some exercises, feel great, then feel worse, and then they start the cycle all over again. People that go through our program and apply it properly, as they get to phase 4, yeah, they might do some up and down along the way, but as they approach phase 4, their worst days aren't terrible. They're like, yeah, I had some hip pain, only walked a mile today instead of my usual 3 or 4. rested a couple days, back to walking 3 or 4 miles next week. That's acceptable. That's a lot of people are like, I'll take that. Not having surgery and have to take a slow day here and there, totally doable. It's because of the weight training. All right, let's keep going here. Number 7. 7's over here. I'm going to sneak it over, actually, kind of between the two. Put 7 right here because I feel like it kind of creeps into harm a little bit. Surgery. This is where I would put surgery. I know I get backlash for this all the time. My surgery went great. People tell us all the time, my hip replacement was the best thing that I ever did. And I applaud you for that. I'm glad that it went well for you, but it doesn't go well for everyone. You guys can look it up. There's cases, you probably have friends. If you talk to people that have had hip surgery, they'll tell you the reality of everything. They'll say, yeah, it was tough the first month or two, got better as it went along. And yeah, they're a lot happier for the most part. Most people are happy with the result, but then they also talk about the limitations. Some people have an absolutely atrocious time and they're having to have the second surgery because of the infections, the allergic reactions they're having to the components they're putting inside. The biggest thing that I see is they'll say, I'm better overall, but I got some issues. I still have pain. It's better overall. There's this low level of discontentment. You hear about the extreme situations where people have to have revision surgeries and deal with infections and they're having like 10 surgeries off the first surgery. Those are the extreme and they're rare. The most common failed hip replacement surgery situation that I see is overall they're walking, they're doing everything, but they still have pain. Why? Why is that? Because I'm sure that's not what you wanted. I'm sure that's not what you expected. You thought, because the doctor said that we're going to take the hip arthritis out, we're cutting off the ends of the bones, so you can't technically get hip arthritis anymore. Yet there's still pain in the hip. And here's the thing, is there's other things that they didn't replace. There's muscles, there's nerves, there's ligaments in the area. And that muscle imbalance that I described, where you have weak glutes, weak abs, over-dominant quads, over-dominant hip flexors. When you have weak abs, you also have over-dominant back muscles. Over-dominant back muscles squash your back, pinch your nerves, and can cause nerve pain in your hip. You still get problems in those other areas that were not fixed by the surgery. And it's because of the muscle imbalance. The surgery is an incomplete fix. It doesn't solve everything. And sometimes it's necessary. I've told people this hip joint is too far gone for me to help. And specifically the one, just so you know who I'm telling, it's when your hip motion has been lost for a long time. You have a severe loss. Let me show you on camera what I mean, just so that you guys can see. If you can bring your knee to your chest, even if you have severe pain, that means that your hip joint is working to bring up right here. But if the arthritis is so bad in the hip joint that the surface of the ball, the inside surface of the socket is so lumpy that it doesn't allow for good motion and your hip joint gets stuck and you have a loss of motion that's like more than 20% loss. You only have 80% of your normal motion. Compared to your other hip, it can go up just fine. And it's been like that for months. Then that's when I tell people, all right, it's probably time for you to really consider the surgery. But if you can bring your knee up 90% or better compared to the other side, even if there's severe pain, because the pain to me isn't 100% a reason to have surgery, because if you offloaded, you probably won't have as much pain, even if your joint's terrible on the inside. It's more the motion, because a joint is a mechanical structure. It's a ball moving in a socket. And if the mechanics are so messed up that it can no longer function, then surgery makes sense. But if the mechanics work, then surgery does not make sense. You need to fix the mechanics. You need to offload the tissues to get things to calm down and then fix the mechanics before they get out of hand. That's what we're doing by fixing the imbalance. Then you have a shot at avoiding surgery altogether and healing your hip for the long term. But I think too many people are jumping into surgery too fast, and then that allows them to continue to have problems afterwards because the root muscle imbalance was never fixed. It carries on with you even after the surgery. In fact, it often gets worse after the surgery because of all the incisions they make. It leaves your glutes even weaker, because if you're using your dominant muscles more, your hip flexors and your quads, after surgery, you don't want to move. You're recovering. You went through anesthesia. You're going to fall onto relying on those dominant muscles again, even more, which makes your glutes even weaker. And if you don't rehab properly, you end up with a worse muscle imbalance afterwards. And that's what often sets up the situation where people say, yeah, I'm better overall, but I still have this low level pain in my hip. Yeah, I can walk and I can do things better than before, but it's not what I was hoping it would be. So surgery, I say, is kind of between the two, because sometimes it is harmful for people. They end up worse afterwards. All right, guys, let's see what comments you guys have based off of all this. I want to give you guys a chance to ask some questions here, or share if you're having some wins, some successes with implementing this stuff. See what you guys got. Who's first here? We have Robert. Good nutrition is important for the whole body, not only for the hips. I agree 100%. I think if you're putting good stuff in you, this, by the way, Robert, this is good. I'm glad you brought this up. People that lose weight oftentimes make better nutritional choices. They're cutting out the junk food and they're eating better quality food, which then raises the question, is it really that the weight loss helped the hip joint, or is it that they got better quality food that stopped irritating the insides of their body, their joints included, whole body? And that's kind of a question you have to think. I have seen cases of people that have done both. They've lost weight, not necessarily eating the best stuff. They just ate less overall and did not improve in their hip joint. And I've seen people that have lost weight eating good stuff and also did not improve in their hip joints. And that's because they didn't fix the muscle imbalance. And I've seen the other end of it too, where people lost weight eating good or bad stuff and did feel better. But I think in that case, they're probably moving. They didn't have as bad of a muscle imbalance, and their condition might have been more related to their nutrition. I do think that's a possibility. But for many of you guys, if you're trying to lose weight and not having success, if you're trying to eat healthier and not having success, it's probably a blaring muscle imbalance that you need to address. And that's where this stuff comes into play. I love that, Robert. Glad you brought it up. Lala says, difficult to lose weight if you hurt to move. I agree 100%. That's why I made that cutoff. That's why I was looking at the data, because I was like, man, it is like, I have trouble losing weight. A lot of people have trouble losing weight, but I don't have hip pain or knee pain. I used to get a lot of knee pain and hip pain. And I realized the BMI thing is also like, the number's not 100%. What's the best word? It's not the best measure, but it's a good measure, because you could have a lot of muscle and technically be overweight or obese. But we have found that that's a consistent thing. People that have a higher BMI, above 35, I think they should focus on weight loss. But even if you're obese, you could still have some extra padding on you and work on the muscle imbalance and get some big improvements on your hip arthritis. So I love telling people that, because then it's a big relief. They're like, oh, okay, I don't have to worry about losing 40 pounds right now. I can just work on fixing the imbalance. Then my hip will feel better. Then it'll be easier to go walking and do exercise to lose the weight. And I'm like, yeah, that's the idea here. Don't worry about the weight loss if it's not that much weight to lose. Carolina says, it is not the weight loss. I lost 60 pounds. I'm at 115 at 5'2". I still was in severe pain until I started these exercises. Yeah, says that. I'm glad you shared that, Carolina. Thank you for sharing. So Carolina lost 60 pounds. She's not a big person, 5'2", 115 pounds. So that's a good weight now, and was still in severe hip pain. It was more mechanical for her, not weight loss nutrition. This is just not, it's not cookie cutter for everyone. But what I do find is a big component. Let me draw this real quick. I love drawing this for you guys. If you think of, I'll erase it here in a second if you think of this as being your hip problem, can you see it okay? Yeah. If you don't have a lot of weight to lose, then what it really is, I would look at it more this way. If this is weight, this is nutrition, and this is muscle imbalance. If you think of all those being a component, For somebody who doesn't have a lot of weight to lose, let's trim that down. It's probably more like this: nutrition and weight. And you really need to focus on that muscle imbalance. And then genetically speaking, some people like Carolina didn't even matter the weight and nutrition. They needed to focus on the muscle imbalance. But if your BMI is really high, then the weight and nutrition become the bigger problem. So this might be weight up here and nutrition, and then actually a little sliver. Oh, I'm butchering this right now. A little sliver is going to be muscle imbalance, and weight and nutrition might be like that. If your BMI is high, over 35, especially once you hit the 40s, you just need to focus on weight and nutrition more. Hope that helps. It's just an idea to think about. It's a concept. It's a guideline. If you're on the heavier side, like the obese 40 BMI side, like you have 100 pounds to lose, go lose 50 pounds first. It'll do you a lot of good. But if you only have 30 or 40 pounds to lose, depending on your height, it might not be that important for you to lose weight right now. You need to work on the muscle imbalance first. Got to consider that for yourself. All right, we have a big one coming in. Let's see what we got here. Lori's on fire today, asking lots of questions. I never want to go through another surgery of any kind. I know. Only if you have to. BMI is 37. Oh, you're right on the edge, Lori. Will using creatine every day? Oh, well, not that one. Okay. It's a separate question. I eat clean. Okay. Good. My sleep was killing me. I wake up multiple times in the middle of the night, having to massage the pain out of my hip and my back of my pelvis, as well as my groin area. Yeah, that sounds like hip arthritis, the muscle imbalance that I'm talking about. I read that inflammation is the base of arthritis. Okay. I can't bring my knee up and can't get my sock on the foot either. I don't want to have surgery. Yep. Is there another part?
You just shared this.
What could be the reason that I'm walking that I feel like I can't stand up straight, and when I do the grocery shopping, I have to hunch over the shopping cart? Yeah, this sounds like, okay. Well, I'm getting a good idea for what you're going through here, Lori. So talking about the BMI thing, like I said, BMI is not a perfect number, because if you're on the muscular side, like I'm the type, I have a football player build. Like I just put on muscle easy. I love lifting weights. I could lose some weight too. I have some extra padding on my body, but I just have more muscle. I will always have a relatively higher BMI according to that chart. Like I'm going to sit on the overweight range. If you look at bodybuilders who have almost no body fat, their BMI is overweight, obese, because they have so much muscle for the height that they have. So you, Lori, and everybody else watching who's got a little, like a BMI that's a little higher, you have to just take into consideration and be honest with yourself. Is this more muscle? Are you overweight because you have more muscle on your body, or because it's more fat? If the answer is if it's muscle and your BMI is 37, as Lori said, then it's probably okay for you to begin working on our program. And if you wanted to join our program, you just have to explain that on the phone to us, because we are telling people, like, go lose some weight first before you join our program if your BMI is too high. But our staff is asking questions to get to the bottom of this. You know, if you're a former collegiate athlete and you're not shy of lifting some weights, and they're going to be like, okay, you can come into the program. It sounds like your BMI is high because of muscle. But if you are honest with yourself and it's more body fat, then you need to go figure that part out. I am not the person to help you with that. I don't know about the creatine answer. And then we have had some people too that are on a trend where they're losing weight. You know, there's drugs out there these days. I don't know, how safe they are. Not place to comment on them at all. But we are seeing people that are dropping weight with these new medications that are out there. And I'm like, well, take advantage of it. If you're losing weight and you're getting into a position where you're able to work on your hip arthritis or your knee arthritis, we have a lot of people joining us for knee arthritis these days. I think it would be good for you to start to do the exercise so that you can get your body that momentum of exercising the right way with the right muscles and get into fixing your hip arthritis problem. So just look at your situation, Laura. You have to, everyone's a unicorn the way we see it, and we need to get to the bottom of this. So I hope that you can get that hip fixed. Being hunched over, that's a clear sign that you're not using your glutes and you're using your back muscles more. It's a big imbalance. People do that because of the imbalance. You feel like you need to lean on the shopping cart, probably. That's offloading that your body is trying to get you to do. Lori, sounds to me like you need one of these. Oh, did she write that already? She's using a cane. Well, the cane might not be enough. You might need a walker. You probably need a walker. That is the classic first conversation we're having with people that join our program, is that they'll say, well, I got the cane and it's just not enough because they're not getting the result. Because you will see the pain go down in your hip if you're offloading adequately. And if you're trying the cane out right now and you're like, not really making a big difference, it's not enough. The cane sucks at offloading. It does offload some, but this much. And you might need this much offloading, and the walker is going to do that for you. Now, I have a basic walker here. You can get some fancy walkers out there that have brakes on them, and you probably know which ones I'm talking about, the ones that have seats and pockets. I don't care. You just need to put weight through your arms and take it off your hip. You can get them brand new. You can get them used at Goodwill or Salvation Army or your thrift stores. Find something to offload. You might have a relative that doesn't need one right now. Go borrow theirs for a while and start using it. And the biggest thing is, I haven't said this about the walker or offloading in general. People think they're going to be using it for months and months. But what we're seeing, what we've learned through the people that we're helping, is if they commit to using the best form of offloading, the walker, it's usually just a few weeks of using it, a month at most. And they're getting tremendous improvements, and then they let it go. You're not going to be on it the rest of your life. The flip side of it, if you don't use the walker right now, let me paint the alternative for you. If you don't adequately offload today to calm your hip pain down, to begin to use the right muscles, then you're on the pathway to having a hip replacement surgery, which after you have that surgery, you will be forced to use the walker, probably for months. And it is the case a lot of times where people don't get off that walker ever. Then you are signing up for it for life, potentially. I have seen a lot of people do that. Or maybe they graduate to the cane and that's where they settle. But I would rather go through the discomfort of using the walker right now before you have surgery for a few weeks, a month, to never have to use it again if you do this right. Versus live with it the rest of your life because you didn't fix the root problem and you ended up having surgery and now your hip's just not right because there's some weird parts in there that shouldn't be in there. I hope that helps you, Lori. I wasn't just talking to you, Lori. I'm talking to everybody here because I'm glad. Thank you for sharing all that, Lori. But you're saying what a lot of people are thinking. There's a lot of lurkers. You know who you are. Haven't commented. They're just watching. They're watching the replay. They're thinking about this stuff. You know who you are. I'm talking to you. And Lori just said what you're thinking. And I'm giving you the answer that you need. You need to get on that walker, guys. Go take it out. Go get one. Krissa says, am I harming myself if I only use one crutch to offload my hip? The number one question that I want you to answer, Krissa, is it working? Is it effective? Is your hip improving? Because if it is, I can't tell you anything. It's working for you using one crutch. Some people can do it. I think it's the minority, but I do see some people do it. I was that guy because I've had to be on crutches off and on here and there, and I know it's a pain to have to carry on both crutches and adhere to using them. And as a physical therapist now, I make the recommendation all the time, as I'm doing right now, to you guys to use crutches or the walker. But I can tell you that if you want to do it right, get both crutches out and just commit to doing it. That way you're consistent with offloading and you're not in those halfway situations where you're like, okay, well, I want to put the crutch down, but now I got to put pressure on this leg, and ended up loading it a little too much in that moment. I'd rather you just go be extreme about it. If you want to be extreme, because if you want to be normal, let me put it to you this way. If you want to be a normal hip arthritis person, you're going to have surgery. It is normal to have a hip joint replacement. It is normal to just go get medications, get injections, do some exercises that the therapist wants you to do, or the orthopedist, that don't really work. Let it get older, because that's what the doctor's going to say, is it's just going to get worse as you age. You're just going to have more wear and tear. And then eventually have a hip replacement surgery. That's normal. You guys are all here listening to me right now because you don't want that, which means you need to have an abnormal treatment approach today to have an abnormal result later where you don't have surgery and you can confidently say, I skipped it and I feel fantastic right now. Look at me dance. My hip is great. You need to be abnormal to get abnormal results. That is the bottom line. You got to do it. Get the walker out and be abnormal now. And have everybody ask you, why are you using a walker? Did you have surgery? And you're going to say, no, I didn't. Well, that doesn't make any sense. Yeah, I know. I'm being abnormal. That's what needs to happen right now. And you're going to see the result. You're going to be like, wow, I'm actually getting better. Not putting pressure on. We have one of the things I've learned. We have people go through our program weekly, go through our hip arthritis recovery program. We share wins on the weekly group coaching call. And they'll say, I finally committed to using the walker. We get this every week. And then they'll say, and I feel so terrible that I waited this long to do it. I feel fantastic now. I know it's going to work. I just needed to commit to using the walker. And all of us here in the office are like, sucks to learn the hard way, but I'm glad you learned. We'll take it. Absolutely. So come on, Krista, get both crutches out. You got this. Josie, I'll just say Josie Nora. Josie, can affected bones recover naturally? When you say affected, I assume you mean bones with arthritis. Yes, absolutely. We see it all the time. It's exactly what I'm talking about. We have people when we took data, half our people, it was like 51% of people in our hip arthritis recovery program, that's how many have gone through, they have been told that they have bone-on-bone hip arthritis. There are changes on the x-ray that are visible. They're affected bones, and they have gotten better. 100%, I think it's possible for you to improve. The main thing that we're turning people away is if you have a chronic loss of motion, a big one, like you only have 80% of your motion left in your hip joint. And it's with that knee to chest test that we're doing with people. That one's been a pretty good indication. If you can't bring your knee to your chest at least 80% of the way compared to the other side, pain doesn't matter in that test. It's quality of motion, because that tells us how the joint is moving. If it's possible for the joint to move more, because you can have a very painful hip, but there's still good motion. That's good. We can work with that. If we offload, we'll get the pain down. There's great potential in your hip joint, though, to heal naturally, even though your ball and socket joint on the x-ray looks like a jagged mess and it's bone on bone. You can still improve. We have that case happen to us all the time. Half our people. Good question, Josie. Who's next? Who else has to comment or ask a question in the comments here that we can help? You guys are asking good questions. I love it. Thank you all for watching here, by the way. It boggles my mind that we're in this situation where we can be live with you guys, and I'm glad that we've gotten here, because thank you all for trusting me and being here, because you wouldn't be here if you didn't trust me. So thank you guys. I appreciate it. Hopefully you're getting some help. Teresa is on Facebook here. She says, I've been doing the glute stretches and now my sciatica is bothering me. Should I back off or continue? Great. Teresa, I need to know. Hopefully we can get a comment out of you here. You said glute stretches. I do not tell people to do glute stretches. I tell people to do glute exercises. There's a difference, because stretching your glutes will absolutely set off sciatica. I would not tell people to stretch their glutes, because in deep to the glute muscles, behind the glute muscles is the sciatic nerve. And when you stretch a sciatic nerve that's already irritated, you will create worse sciatic problems. So I do not tell people to stretch their glutes. Now, activating their glutes, flexing the glutes, tightening the glutes, That is generally a good thing. However, if the sciatic nerve is extremely irritated, even that good glute exercise might not feel great right now, which means it's not time to do it. There's other things to do first. That is why I said this stuff is good to do: glute activation, ab activation, weight training, but this comes after you're not irritated. That is why we have phase 1 of our program that is not focused on fixing the muscle imbalance yet. Phase 1, it's focused on calming down the pain, because here you have severe pain 7 days a week, potentially stiffness in your hip, night pain. You can't be on your feet very long, and your glutes don't know what the hell they're doing. They need to figure that out. They need to figure themselves out. You may not have everything, but you may have at least one of these. But as you move into later phases is when you can begin to do glute exercises. If you have severe sciatica right now, or any sciatica, and glute exercises are worsening it, you need to go into phase 1 activities, which it's free, by the way. You can go look at it. No need to log in. You just hit play on that first video, and you're starting the phase 1 of the hip arthritis program. So I'd say back off and go check out phase 1. That's my advice to you, Teresa. Who's next? We got Patty Adams. She says, will this advice help with people who have dual hip dysplasia and hip joint arthritis in both sides? My most honest answer, Patty, is I don't know. I am not a hip dysplasia specialist. I am a hip arthritis specialist. However, it makes sense that it would help, because getting better glute strength would help to position the ball in the socket better with hip dysplasia. That's a good thing. But I can't say with confidence that I've helped a lot of people with hip dysplasia. I suspect out of these 2,164 people, some of them have had hip dysplasia, but I don't hear about all those details from everyone in our program. But I don't think it'll harm hip dysplasia. The number one thing you can do is try it out for yourself. Our treatment approach that we have in the hip arthritis recovery program is gradual, so that you start with light stuff and work your way along to the heavier stuff. And we tell people throughout the program it shouldn't hurt you any worse. And so you've got hip dysplasia and you want to work through our hip arthritis program. It's structured in a way where you can monitor if it's going to make anything worse along the way. And my recommendation, if you have hip dysplasia, is work with a doctor for hip dysplasia. And if you want to go through our program at the same time, I think it would be beneficial. And we also have breakthrough sessions and one-on-one opportunities in our program. You can ask me questions directly. We'll be on a Zoom call with a group, and we can talk about hip dysplasia in the weekly group coaching calls. But I'd say it's worth a try. What are the alternatives? Get a hip replacement. What if the glute exercises work? But you're not going to know if they work unless you try them thoroughly. Not just like I kind of tried them. Like I seriously committed to trying them. I would say start there. Good question, Patty. Carolina Country Chick. I have learned most of exercises you have taught us about, Dave. I, however, have a problem with relaxing my muscles. I tend to keep them tense all the time, and I think this is adding pain. Okay, that's a possibility for sure. You might be overdoing it. Yep, that happens, Carolina. I think you're answering your own question here. I don't feel like I need to say much. I'd say you're probably overdoing it. You need to tone it down. We have people like that. I guess the best bit of advice I can give you is I have talked to people in our program who sound like this. And then I ask them this. I say, are you a busy bee? Are you a type A personality? You like to have things tidy in your home. You like to make sure things are done right. You're the A students growing up. If that's the case, I love it. It's served you well. But going through this program, you probably are overdoing it. And because your body responds, you can inflame things if you're overdoing it, even if it's a good thing. It's feedback to you that you're overdoing, and you just need to know to tone it down a bit. That's it. Dial it down from 100% to 90 or 80, maybe even 70%. In some cases, even 50%. And see how that works for you. This is good stuff. Mechanically, it is sound. It works. But there is some finagling. There is some trial and error to figure out how to make it work for you in your specific situation with your lifestyle. You wrote Country Chick on your user profile. Maybe you got farm animals. Maybe you ride horses. Maybe you're your lifestyle is going to be different potentially than a city person. And so you've got to adapt the same concepts, the same principles to your situation so that it works for you. But it can work for you once you do that. And in our program, we can talk about those details, how to adapt it. But if you need help, some people figure it out. Good question, Carolina. What else have we got here that we can help? We're looking through, sorting through comments here, making sure that we answer the best ones. Josie says, why are there people over 80 have nothing of off arthritis? They are more sportive as me. So why are people 80 and up more active and don't have arthritis? Great question. One, I would say, is genetics. I truly believe some genetics just don't. Some people have great genetics, and even as they get older, they just don't deteriorate as fast as others. There are some genetics where people are prone to getting arthritis. I think that it comes down to the muscle imbalances still. I have treated those 80 and 90-year-olds even that are still running. And the pain that they have is from overdoing it. They're just running too much. I'll look at their muscle imbalances. I'll look at their joints, and I'm like, everything looks good. You look like you have the body of a 30-year-old on you. You are just overdoing it right now. You just up the running from 3 days a week to 5 days a week a little too fast. So part of it's genetics, but I wouldn't worry about the genetics and try to think, what is this 80-year-old doing different than me? You've got the body you live in. Your responsibility is to work with what you've got. And if you're already experiencing hip pain, hip arthritis, you probably have a muscle imbalance, and you need to know that is your body's tendency, which means you need to be working on certain things to keep it from getting worse. Just like some people are predisposed to getting diabetes. Some people are predisposed to getting certain cancers. I think that's all genetic, and it's the same thing with arthritis. Some people are predisposed to getting osteoarthritis in the hips, in the knees, in the back, wherever it is. Because some of you guys are in here. You get arthritis all over. My hands, my feet have it, my hips, my knees, my back, my neck, my shoulders. It's all muscle imbalances. It's just that if you fix the muscle imbalances, your joints will feel better. Just like the person with diabetes doesn't have to have diabetes if they manage their diet and exercise. The person with skin cancer doesn't have to have skin cancer if they manage their exposure to the sun and whatever else causes cancer. That's not my specialty, but there's ways to prevent these things even though you're genetically predisposed. And this is the way you prevent osteoarthritis, is by fixing the muscle imbalances. Great comment there. All right, we're going to keep going. Finish off this list here. What is number 8, 9, and 10? So just to review where we're at so far. We're on the help spectrum. On this end of the spectrum, we have long-term help. In the middle, we have short-term help for hip arthritis, and then things that harm you. And what I talked about being long-term is education is important. Specifically, education about the cure of hip arthritis, which is by fixing the muscle imbalance. Because the cause of hip arthritis is when your muscles are imbalanced. So if you fix it, you're curing it. And to cure it, you need to get glutes to become active, abs to become active, and then you've got to strengthen them over time. Some things that can help in the short term are offloading, and then not worrying about weight loss. Sometimes you need to work on weight loss if your BMI is over 35, but if your BMI is under 35, you can just work on the muscle imbalance, fix the muscle imbalance, and you'll probably feel better and then be able to lose the weight that you wanted to lose if that's what you're trying to do. Number 7 is surgery, and I staggered that one over here because it can be short-term in that it can help, but it can cause some problems too, which is kind of moving into the harm zone. So what's number 8? Yeah, here, my markers are over here. Where's my blue one? Oh, it fell. So sorry. I got it. All right, this one's kind of a long one, so I'm going to fill up some space here. So we're talking about medication. I'll just write meds, injections, and regenerative medicine. I'm going to explain all of these to you guys. So medications are going to be your ibuprofen, naproxen, Tylenol, your pain medications that you take by mouth. These are short-term relief, and they might be beneficial for you. in the short term. I think we all get it that you can't take Tylenol, you can't take ibuprofen and expect your hip arthritis to go away forever. It's only buying you time for today. And that's how I think it should be used. If you have to go work today, or if you have to take care of that loved one and you know it's going to affect your hip to do these things, you have to go grocery shopping, you have to deal with cooking the holiday dinner, and you're going to be on your feet all day. You just have to do some things in life because you're a responsible person. You might take some pain medications to get through the day. And I think that is okay if you're conscious about using it in that manner. What is not okay is if you're taking pain medications indefinitely every day. If you're taking them just as your current solution for hip arthritis, not a good idea. Your doctor will tell you this. All the commercials have the disclaimer at the end. Take this pain medication for relief. And, they show the person petting their dog and going for a walk and high-fiving their friend. That's how these medical commercials are. But then there's the last 30 seconds of the commercial of side effects include nausea, vomiting, death, liver disease, blah, blah, blah. It's got some serious side effects if you're taking it on a regular basis. Don't take these on a regular basis. Consult your doctor and see what's right for you and how frequently you should be taking it. But it is general knowledge. The medicines say it on the bottle, on the label. Don't take these for too long. Follow the instructions and make sure you're safe, please. Short-term solution. Injections, same thing. You're probably going to go to the doctor to get this done. They're going to recommend it. You might ask and they'll say it's okay for you. But this is where medication is injected into your hip joint for the purposes of reducing inflammation and helping with pain. Now, they don't typically allow you to do more than a few of these per year because it is well documented in research studies that specific injected medications like cortisone, for instance, steroid injections, they break down ligaments and bone and cartilage. And so although they help with the inflammation process and pain in the short term, inflammation is actually the first stage of healing. It's necessary to go through inflammation in order to go to the next stage and the stage after that where you can complete the healing process. However, if you haven't fixed the muscle imbalance, you're going to be perpetually injuring your hip because that ball and socket is not lined up properly and you're putting bad forces through it. This is why people have chronic hip pain, hip arthritis. So injections are not fixing the imbalance. They're not changing the way your glutes or abs work. They're just very pinpointed pain medications, anti-inflammation medication to help you feel better. And some people truly get months of relief, a month at least. There are some people too that say it had zero effect. So it's a hit and miss, but just understand that it's a short-term pain relief. When I say short-term, meds are usually hours, maybe a day. Injections might last weeks, maybe months. They're short-term. I put surgery here in short-term because maybe you get benefit for months, potentially years, but it doesn't fix the root problem, which isn't addressing the cure. Therefore, the pain often comes back. And people talk about it. The pain is still there after they've had a hip replacement. So that's meds, that's injections. What about regenerative medicine? Regenerative medicine is like your stem cells, PRP injections, hyaluronic acid injections. They're the alternative kinds of injections. These regenerative medicine injections are not getting your glutes more active. They're not getting your abs more active. Therefore, they're not fixing the muscle imbalance. The way I see them is they're just buying you some time, short-term time. Potentially the hyaluronic acid cushions your joint better and maybe has some properties that can assist your cartilage in feeling better inside your hip joints. If you had stem cells injected, maybe you are going to get better cartilage inside your hip joint, regenerated cartilage. But if your muscles are still yanking the ball forward in the socket and squashing the joint, no amount of new stem cells is going to save you. You've got to offload that joint in the short term and then fix the mechanics for the long term to allow those to possibly be affecting you for the long term. But a lot of people are going to go get these PRP injections and stem cell injections in hopes of regenerating some cartilage. And I think that they're misled. because they're not fixing the imbalance. So people ask me all the time, what about stem cells? What about PRP injections? What about should I get the gel injections, the hyaluronic acid injections? And my answer to them is always, you can try it. Absolutely. Don't let me stop you from doing it. Just have a good understanding of what it's supposed to do and what you can expect afterwards. If you don't fix the muscle imbalance, if you do nothing to fix the imbalance, you're going to have very short-term results. Potentially, you'll have a better result using the regenerative medicine techniques if you're fixing the muscle imbalance at the same time. Now you give those stem cells a shot. Now maybe the PRP can heal your cartilage because it's not being over irritated with bad pressures. So just make sure you have the right understanding. It's not a hard no, it's a know how to use it. It might be beneficial in the right way, when using the right way. So that's number 8. Short-term. Well, I think I might have skipped one. Short-term help, surgery, medications. Okay, I think I did. 1, 2, 3, 4, 5, 6, 7, 8. All right, let's go on to harm. Number 9. Oof, I'm going to raise some concern with this one. General exercise. I think that the recommendation to just do general exercises is harmful for hip arthritis. And here's what I mean by that. If you have hip arthritis and you get told to do leg raises, let me show you the exercises that I'm talking about, the general exercises. Very common exercises is you'll be in a therapy clinic, you maybe get these online somewhere on a sheet from the doctor's office, and they'll say, you have hip arthritis, you need to raise your leg 4 different ways. Raise it this way, then turn on your side, move your other leg out of the way and raise it this way, then lay on your tummy, raise it this way. This is the only one that might be actually good for you. And then turn on your other side and raise your leg this way. And the instruction is simply to raise your leg in different ways. And you might do this in standing too. They might have you stand up and say, do the same 4-way leg motion, pick up your leg forward this way, move it out to the side this way, move it across your other leg that way, and then move it back that way. In this scenario, this is a very common exercise. There's other exercises too. But specifically the 4-way is one of my pet peeves. That one that I just demonstrated to you, standing or lying down. There is zero instruction about which muscles to use. There is assumption from the medical professional that you will just use the right muscle. And their thinking is that exercising all the muscles around the hip is what will make your hip better. And this is so short-sighted because what they haven't paid attention to is that you're not using your glutes. We had comments on here that I just read that people are saying, I found my glutes. I started to use my glutes finally. They were not conscious of using them. And if you just go start doing exercises willy-nilly, however, without thinking about your glutes, you're not going to be using your glutes because it takes you so much conscious effort to use your glutes. In phase 2 of our program, we spend a significant amount of time just activating the glutes and abs. And that 4-way exercise, if I were to place it in our program somewhere, it would have to be phase 4, which means that you should have already been consciously activating your glutes. But people are starting there. They're starting with the 4-way hip exercises. And it's not just that. There's other exercises like sit to stand. Sit to stand. It's a super common exercise that people are doing in physical therapy. Sit down in a chair, then stand up, and do that 100 times, 30 times, whatever they recommend that you do. And there's zero instruction on what muscles you're using. It's very possible for you to stand up more with your quads and even hip flexors, but it's also very possible to stand up more with your glutes. And if you're not conscious of which muscles you're using, then you're either feeding into the muscle imbalance and worsening how far that ball is moving forward in your hip socket, or you're helping it. But if you have not had any instruction on how to do the exercise properly using the right muscles, glutes and abs, then it's harmful for you. This is why so many of you guys have been to physical therapy and you say, I am getting worse. My hip is hurting more when I go to therapy. Because it's harmful. You're not doing it right. And you don't know to do it right. You're following instructions. It's not your fault. But you're here learning about it. So now you're going to know better. You need to learn how to use your glutes in everything that you do. And if you cannot fire your glutes and make that the muscle that gets most tired as you're doing the exercise, then you shouldn't do it. Stop doing it because it's worsening your situation. And that's tough to hear, especially if you're going to a medical professional, if you're going to the surgeon, the doctor. But you've got to listen to your own body. And, I completely respect the fact that if you're working with a professional in person, you should probably listen to what they're saying. But you've got to take your own initiative and be a advocate for your own health. And if you're feeling worse in your hip, maybe what they're recommending is not right for you right now, or there's something going on that's not right. Maybe it's a good exercise done wrong. Maybe it's a good exercise done at the wrong time. This needs to be determined in order for you to improve. This is why I have built this phases chart. This is something that is not seen anywhere else in healthcare. I have never seen this. This is the phases of healing put into criteria to fit you in. And this is how you determine what you should be doing. As you go into the program, you'll see this in our free phase 1 of a hip arthritis recovery program on our website. There are certain exercises that you should do here and certain exercises here that are different. And if you're trying to do exercises that are from a later phase, but you don't qualify for that yet, you're going to hurt yourself. You're going to make it worse. That's what they're doing when they have you do these exercises. You're not ready to do them because you don't even know how to activate your glutes yet. Your abs, you're not even aware of your abs yet. And you're being forced to do these advanced exercises that require you to have good coordination. But nobody verified that you can fire your glutes. That's why you're getting worse. It's a big deal. All right, so last one, number 10. This is a biggie here. Walking. And it's in line with the general exercise thing because you go to physical therapy or you talk to your doctor who just diagnosed you with hip arthritis and they'll say, you need to lose some weight and you need to start a walking program. I'm going to send you to physical therapy. Start walking thousands of steps a day. If you get to 2,000, then 5. If you can get to 10,000, you're on a good pace. This hip arthritis problem is going to get better if it's going to get better with walking. And they're saying all this because they're thinking about the research studies that they've seen. But if you're just going on a walk, no thought about using your glutes or your abs, what muscles are you using? By default, you're using the muscles that are used to working. And it's probably not your glutes. It's your hip flexors and your quads. It is possible to walk without your glutes. That's why people waddle when they walk or they wiggle their hips because they're accomplishing the walk in a way that skips their glutes. You know who you are? You've had that funny movement all the time. And then once you figure out how to use your glutes, all of a sudden you kind of straighten out. You walk better. Because it's the way we're supposed to walk, with our glutes being the primary driver of motion when we walk. But somewhere along your life, likely all those years in grade school when you were sitting, and then all those years in college or your job when you're sitting, your glutes just didn't get much activity. And they started to shut down. And it's carried over into your 40s, 50s, 60s, 70s. And now it's developing that arthritis problem because you have an imbalance. And when you go try to walk more, exercise more, especially walking, you just use your quads and hip flexors more. And minimally use your glutes. And that just feeds the imbalance. Walking is then harmful for you. This is why people go walking. Initially, they'll feel good. They'll say, oh, I went for a 10-minute walk. Oh my gosh, I hadn't done that in a while. I feel great. It was nice to see the sunshine and get the wind in my face and see the trees and the squirrels. But then once you start hitting 7,000 steps, 10,000 steps, people start saying, my hip is killing me. It's too many reps for you with the wrong muscles, and it's wearing on your hip joint. It's causing irritation. You need to go offload. You need to stop walking, and we need to start here and fixing your glutes by fixing the imbalance. And even before that, we need to get education on how this all works. Why am I saying this is the cure for hip arthritis? You need to understand that. You might be looking at this video right now and saying, this guy's a quack. This guy doesn't know what he's talking about. He's saying, just work out the glutes. Have you really paid attention to how the muscle imbalance works? Go back and watch that section I talked about in the beginning of the video. Wrap your head around it. It mechanically makes sense. I can't tell you the number of physical therapists that I've talked to, doctors too, like orthopedic surgeons. When I get the chance to talk to them one-on-one and they're open, because they're not always open to talking, and I explain the muscle imbalance in a calm way, and they're like, this makes sense. Why are we working on hip flexors? And they'll do it themselves. They'll get their glutes to activate and they'll say, I feel it. I need it. Oh my God. And then they have the realization afterwards. I see it all the time. Then they start to realize, oh my gosh, all the patients that I've told the wrong exercise, all those patients that I just put on the treadmill to walk, all those people that I recommended to get to 10,000 steps, that's why they got worse. They realize it after the fact. Now, I put walking under harm. But what I want you to know is that walking can also be a long-term help. Let me make the connection here. Walking can move over here on the spectrum of help if you can make your walking glute dominant walking. If you can make your butt muscles flex each time you take a step, as you bear weight onto the leg, you tighten your glute on that side and then alternate to the other side. If you can make yourself walk like that consistently, at least 8 out of 10 steps for all the steps you take, then it's no longer harmful for you. It's actually helpful for you. Same thing with the elliptical. We had a question about the elliptical earlier. If you can make elliptical glute dominant ellipticaling rather than hip flexor quad dominant ellipticaling, then it's no longer harmful for you. It's now helpful for you. Sit to stand can become helpful for you if you make it a glute dominant sit to stand. A lot of exercises that you're probably doing, you're just missing using your glutes on them. And if you can get them to consistently activate, it can now become a part of your long-term solution. That's why the education is so key, because some of you guys here are looking for some magic exercise or some magic technique, and it doesn't exist. Fixing hip arthritis is a process that begins with education about how it occurs, and then filling in gaps about how to practically make it work for you by firing certain muscles. And not all exercises are bad. Not all exercises are good. Exercises are neutral. It's just about how you do them. And if you can make them glute dominant, then they can become good for you. Walking, bridges, squats, ab exercises, all kinds of ab exercises. This is why I'm not spending a bunch of time telling you exercises here, because it's not just about the exercise, it's about how you do them. It's about the knowledge behind the exercise. We got to get there. We have to attack hip arthritis at the knowledge level first. All right, guys, that's my presentation. Let's see what comments you have, what questions you guys have, so we can fill in any gaps for you guys. Who is first here? Santosh says, Tai Chi walking good. Santosh, same thing that I'm saying here. Are your glutes working in Tai Chi walking? Because if you're not using your glutes in Tai Chi walking, it's probably not good for you. But if you're using your glutes in Tai Chi walking and you can feel them activating, and that being said, I've not heard of Tai Chi walking. Like, I don't know what that looks like. I know what walking looks like. I know what Tai Chi looks like, but I don't know how they look combined. I'm not sure if there's something I'm missing here, but my general guidelines here is that if you can do it with your glutes and you're not over activating hip flexors and quads, it's probably going to be good for you. But if you're just asking me a question like that and you want a yes, no answer, I can't do that for you, because there's no guarantee that you're using the right muscles in that exercise. It's like if you ask me, is walking good? I just told you it might be bad, but if you get your glutes to work, it's good. Is elliptical or cycling good? I think it's bad for most people unless you know how to fire your glutes during that exercise, then it's good. Glutes are the key here that everyone is overlooking. There is a cure. We have it. It's here. I'm telling you. But everybody's looking for some missing protein or some cartilage regeneration medication. But your body will heal if you correct the mechanics. It just takes effort. We just want some convenient shortcut. This is not convenient, but it's good for you on so many levels. Besides just fixing the hip arthritis, you're going to benefit a lot from having that strength and being able to exercise regularly. So good for you guys. Robert says, actually, when the root cause is muscle imbalance, what has caused the muscle imbalance? What is the root cause of the root cause? That's the way to think about it. And, you know, we can go back many steps. I really think that it's how we grow up, how we move. It's our Western culture. Because I visited China once, like almost 20 years ago now. And Robert, I saw 80-year-old men smoking cigarettes, squatting, the best I've ever seen. Because everybody squats in China because they don't have toilets. In most of China, they have the squatty potties, the hole in the ground. And so they're squatting all the way down on a regular basis. And even though they take part in some other health practices that are not good, their joints are excellent and they're very active in many areas of their lives. So I think it has to do with the physical activity that they regularly do. And in Western culture, we sit in school all darn day. And then we have devices like you're probably watching me on right now, mobile devices, smart devices that cause us to stay stationary for long periods of time. And so we're just not using our glutes. I think that's the cause. But at the end of the day, you can fix it by doing this stuff here on the long-term side. You can get your glutes to activate. You can build some routine where you're activating them on a consistent basis, and you will fix arthritis. Because if you're going back to it's school, you know, are we going to change school? Are we going to change sitting jobs? I mean, you could get a standing desk. You can get a treadmill under that standing desk like we have here in the office. But at the end of the day, that's not going to strengthen your glutes immensely. You could use your glutes while you're walking, but you might need to still do some weights, and you can't do that while working. You have to figure out how to adapt this to your life. Glutes are the key for sure. All right, who's next? Here we have just a few more minutes. David says, Robert says, Dr. David, can you repeat which glutes are relevant? Only maximus. I don't think I think it's hair splitting to look at which glutes. The main thing that I want to tell you, I'll just say this quickly. If you look at the side camera here, if we're talking about glutes, we're talking about the meat of the muscle back here. A lot of people are focused on the side here, which then they'll say this is gluteus medius, but there's other muscles here. Minimus is under there too. You have some deep rotators that if you go deep enough, you'll feel there's a lot of muscles in the area. The main thing, Robert, is that you move your muscles with your leg going back this way, not out to the side. I think that's a big mistake. I think you got to go backwards, not sideways. And the reason is because if we work abduction, if we work out to the side, you're also going to hit TFL and some other muscles that are more hip flexors, opposite of hip extensors. And we need to focus on hip extensors in general. There's glute maximus. Part of glute medius is a hip extensor. The gemellus inferior, the two gemellus, inferior and superior, obturator, internus, externus, quadratus femoris. I can list all the muscles here. You don't need to worry about the specific glute muscle. You just need to make the butt burn on the back. That's it. Make it burn in the back. Hope that helps you, Robert. Oh, we got a super chat. Thank you so much. This is Super Wacky Wabbit. Please go into depth about safety and exercises for AVN, avascular necrosis of the femoral heads, prednisone related. Had it for 2.5 years, carnivore diet, no pain meds, no surgery, not collapsed. Oof. I can, okay, let me do my best here. Avascular necrosis means that the blood supply to the head of the femur is compromised. And so there's less blood in the area, which can weaken the bone. Now, in the idea that I'm telling you about with the muscle imbalance is if you have weak glutes on the back, over-dominant hip flexors in the front, it's going to put bad pressures in the hip joint. Because it's bad pressures, it's not pressure that the joint is designed to take. The bone structure on the inside of the head of the femur, the bone structure on the other side of the socket. I think that this muscle imbalance will wreak havoc on somebody with AVN. Therefore, I think it's actually good for you to strengthen your glutes, like I'm saying, because it normalizes forces inside the ball and socket joint. And if you already have some permanent damage due to AVN, I think it's going to preserve it. Notice I said I think a lot because I don't know. What I need to have happen is guys like you, people like you who have AVN to try this out and see. And I strongly believe that if you're being careful and doing these exercises lightly, like I'm talking about in phase 1 and moving into phase 2 gradually, I'm never saying start deadlifting 100 pounds. That's how we start fixing hip arthritis. No, that will absolutely be dangerous for you. What I usually say is, can you just tighten your glutes in standing, in lying down? Just tighten the muscle. You do that to walk around, hopefully. Very low chance of you worsening AVN or hip arthritis if you're doing that. And even before then, I'm telling you to offload, which is taking pressure off the joint, reducing forces through the joint. And even before that, if we're going back in Robert's situation, what's the cause of the cause? We're learning. You need to learn first. Don't even do any movements. Just learn about how this process works. So go through the program as I designed it. Start with education. Start with offloading, phase 1 stuff. Then get to exercises. I think you'll be safe. And you'll know that something's getting worse because we're taking this process so gradually. We're focused on the process, not a technique. So I think if you do it that way, you'll be okay. And you'll probably have a good result. That's my educated guess, but it remains to be seen. We need to try it out and see. We need feedback from people like you guys that are out there trying this. So best of luck, Super Wacky Wabbit. Servet here. Thank you so much for another super chat. You just gave us a donation. Thank you so much. My team is grateful. I am grateful. Glad you found some value in this. Dr. Lyons says, is walking backward short distance as supposed relief of knee pain, for example, helpful or harmful? Absolutely harmful. How many of you guys can walk backwards using your glutes? It's hard, very hard. As a result, you're going to use your quads and hip flexors a lot, which goes completely against the muscle imbalance concepts that I'm talking about. And it is harmful. If there was another level of harmful, I'd put walking backwards over here. Very harmful. It's been over dramatized. It's been over recommended. I think it's been a social media craze, a trend. I do not think it's a good idea. Maybe some people have benefited, but I strongly believe that it's so short term. The benefits you're going to get, it ends up putting you into the harmful section. And practically speaking, you don't need to walk backwards in life on a regular basis. Maybe you take a step or two to back up, but walking backwards continuously for minutes, unheard of, unsafe. On top of that, if you're on a treadmill and you know that it's just the tread under you, okay, I can see how that's safe. But outside of being on the treadmill, when do you walk backwards? It's extremely rare. Very, very few circumstances will call for that. So I think it's a very impractical and harmful activity to be doing. I think we should be focusing on how to fix the imbalance, which is glute exercises. Walking backwards, in my opinion, is one of those techniques, one of those tricks that just got blown up on social media, and it's not productive for everybody. Another super chat. Oh, where did it go? I'm done talking to Dr. Lyons. I think I answered it. Thank you, Dr. Lyons. Robert says, thank you for your replies. Thank you for the super chat, Robert. Appreciate it. Hopefully you get some help out of this. Julie Parker says, I feel like all this helps for the knee as well. 1,000%, Julie. This same muscle imbalance affects knee arthritis and other knee problems. Linda says, what about the rebounder? I health bounce and it is not painful on my hip arthritis. I think the rebounder should be in this column too. I think there are a few exceptions of people out there that can activate their glutes while on the rebounder. That's that mini trampoline. But if you're not activating your glutes on the mini trampoline, on the rebounder, probably not a good thing for you. And if you're doing the rebounder right now and not activating your glutes and not having pain, what I can tell you, Linda, is it's coming for you. It's just a matter of time before you increase those forces going through your hip and knee joints and you pass a certain threshold where it's going to get achy. And if you keep going, it's going to get real painful for you because it's mechanically putting bad forces on your joints. It's just a matter of time. Super Wacky Wabbit. I love the name. Awesome. Thanks. Makes sense. Been subscribed for 2 years. I got to do exactly as you're saying. Truck driver, lazy, massive imbalance in muscle strength. Yeah. It's just our jobs in Western culture. We sit a lot, and it's okay. Like, don't feel bad about your profession. If you have a sitting job, truck driver job, desk job, whatever it is, you just have to build in some sort of regular time in your schedule when you're not working, where you work those glutes out, and then you'll be able to keep up your job. I think that's very possible. Great, thank you for the super chat. We have Saran. I'll just say Saran. Should you do glute work daily for hip arthritis? My hip flexor is tight from the front of the hip to the side of my lower abdomen. Saran, we tell people to do glute exercises hourly in our program. Absolutely, you should do it daily. Most people are underdoing it. And we have those few type A's, like was it Carolina earlier? You get to the point where they're rare that you actually overdo it. Most people are underdoing the glute exercises. And I'm not talking about taking 20 minutes every hour to do glute exercises. We start off with some exercises that take a minute, seconds, maybe 2 minutes at most, depending on how thorough you want to be with the exercise. If you're doing that hourly, it's very doable, and it doesn't have to be a big distraction from your day. It's going to take up some time, but if you can properly implement glute activation into your life and become obsessed about using it in all your motions that require you to be on your feet, even to while you're sitting, you will get massive results in your glute activation, which will translate to massively improved hip pain and definitely avoiding a hip replacement. Good question. Salsa Louise says, I'm in the hip arthritis recovery program and I can't recommend it enough to everybody. Thank you. Thank you, Louise. I appreciate that. That's so cool. Thanks for joining us here. Dr. Lyons. Oh my gosh, Dr. Lyons. Thank you so much for the super chat. She says, thank you. I am determined to follow your advice and reverse this problem. It came on slowly and I guess it will be corrected slowly too. Yeah. I am committed to this muscle imbalance. You're on the right track, Dr. Lyons. It just takes some time. This is a process, guys. You're not going to fix hip arthritis with an injection, with a surgery, with a technique. It is a process of which we've built a structured program to walk you through. So the cure is laid out for you. It's just a matter of following it. And this is a kind of an overview of what you should and shouldn't be doing based on the spectrum of help that you can follow for hip arthritis. And my intent is to educate you because there's so much information out there and you need to figure out what's right for you and what isn't. And I hope that I can be a source of truth for you guys. Hey guys, thank you so much for joining me here today on this live stream for hip arthritis. I look forward to seeing you guys again next week. Bye guys.